Hello, 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 and welcome, welcome, welcome. I am Dr. Ashley Booth, and if you are here for the first time, I am a board certified family medicine physician, and I am passionate about health education. And today we are going to get into advocacy. Like, what is it and how do you do it? Because I understand that there are a lot of barriers and issues that we encounter in our healthcare system. But one of the ways to get what you need, one of the biggest ways you can do that is to be able to advocate for yourself. So I am going to teach you 5 simple steps on how to advocate for the health care that you absolutely deserve. So go ahead, share this with people, let them know that we are live. Let your friends know, bring your questions because I want this to be as interactive as possible because I want for you to get the information that you need. But if you have something specific that you say, hey, I wonder how would I approach this? Let me know because I do this a lot for my patients and that's why I'm bringing this to you. If you are watching, also drop it down and let me know who you are, where you are watching from, so that way I can say hello. But I want to make sure that we go ahead and get into this because this is a huge topic, and I think this is one of the most important things that I will talk about. I'm passionate about advocacy, and although I'm giving you the 5 steps today, I know that I will bring you some tips along the way on how to do it because I am starting to see more and more patients learning that they are going to have to advocate for themselves. But what exactly is advocacy and why is it important? Well, to advocate for someone or for yourself is basically to support or recommend something, right? Support or recommend. And if you are going to support or recommend something, that means you have to understand it, right? Well, what I'm understanding is that a lot of people don't understand. They do not understand what's going on. And so that is one of the things that is hindering them because if you don't understand what's going on, how are you going to be able to talk about it and discuss it? Because what I've learned is a lot of people tell me that they are scared. They are also leaving the doctor's office with more questions than they are answers. And they are just utterly confused. So, like, I don't even know what they said. I have no idea. Well, when you do that and you're in that situation, it really prevents you from going to the next step, especially with your health, because in order for us to do the things how we want to do the things, when we want to do those things, we have to be well to do it. But if you are not getting your concerns addressed and you're still dealing with something, then that is going to affect you overall. So, what I learned is that you didn't go to school for this. You were not trained in this, and that is totally okay. But you still need to get your answers. And so, what I do all the time for my patients, I advocate for them. And then I also teach them how to advocate for themselves. So, let me do the same thing for you and give you these 5 simple tips on what you can do to advocate for yourself and for your health. So the first one is a big one. And I teach this all the time with a lot of different tips that I give you guys. And it is being prepared. And some people give me the eye roll like, oh, but a lot of times you want to go ahead and do the things, but how can you do them if you're not prepared? I do a lot of DIY projects. I love DIY projects. And a lot of times I want to get to the end goal. I'm like, I'm ready to see this project finished. But I've learned over time that if I am not prepared and I don't have all of my tools and things that I need in place, then I am not going to be able to have this beautiful artwork or piece that I want to have finished because I have to keep stopping because I have to go back and get something. Oh, I forgot this, I forgot that. So you have to be prepared. Your very first step is being prepared. But how do you do that, especially when it comes to your medical health and condition? When you go to your doctor's office, the first thing is you're going to come in with a concern. There's something that you are concerned about. Well, what you need to do is be specific about that concern. Like, when did it start? How long has it been going on? And be specific about that. Did it start last night? Did it start 2 weeks ago? Did it start 6 months ago? Whatever it is. But let us know what you have going on. When did it start? And then let us know how it is affecting you. Like, what did you take for it? Did you take um, an over the counter medicine? If so, we need to know the specific name of that medication because there are a lot of different brands on the market. I tell people all the time there are a lot of Mucinex now on the market. There's Mucinex regular, there's Mucinex DM, there's all these different things. So, depending on which one you took, tells me what medicine is in it and if that is truly helping you or if it's not helping you, and then what the next step is for me. So you have to keep track of that information. If you're taking any supplements, we need to know that. If you're taking medicines from a friend and someone let you try something, we need to know that because that lets me know did that help, did it not help, whatever. But the more information that you have, the better. So you want to keep track of that. You want to be specific. You also want to know any personal history that you may have had. If you've been diagnosed with something in the past, like diabetes, high blood pressure, headaches, whatever that is, were you taking any medications for that? If so, what were those medicines? And be specific about that, even if you're not taking them anymore. And someone says, well, I have a stomach ache today. What does my blood pressure have to do with anything? It has a lot to do with it because it lets me know, is that medication causing that problem that you have? Is it something that's not well controlled? There are a lot of different factors, and it lets me know where I need to put it in there. Will this medication interact with this other medicine that I'm thinking about giving you? So, the more information that you have, the better. So, keeping track of all of that information. And when you have it, keep track of it in a place where you can keep up with it. One of my favorite places, the phone, because the phone is one of those things that you usually will not forget and you will take to your doctor's office all the time. So put it in your phone. You have like a little notepad or something that's in there. Pull that up. You want to keep track of at least two different things. One, you want to keep track of like chronic diseases or anything you've ever been diagnosed with in your past. So put that information in there. I was diagnosed with headaches, diabetes, high blood pressure, whatever. Then what medicines were you treated with it with? Put the name of the medicine, the dosage of that medication, how you were taking it or how you were supposed to take it. Keep track of all of that information. Then you can create another one for things that are what we call acute and what's been just now bothering you or going on for a little bit of time. So that's where you want to put the list of things that's been happening. If it is, toe pain, leg pain, backache, stomach ache, any of those things, that's where you want to put that there. And for each one of those, you want to go back to what I said. Is it happening? How long ago did it start? What medications are you taking with it? What are the symptoms that you have with it? When you do something, does something else happen? Keep track of all of that information and put it all there. You want to have it in a centralized location. The other place that people can do it is you can write it down in like a personal health history notebook that I tell people about a lot. If you have one of those, you want to make sure that it makes it to the doctor's office with you because I have a lot of people say, "Oh, I left it on the kitchen table. Oh, I left it here." So you want to make sure that you are putting that information where it needs to go so that it can end up in front of me and I can go through it with you. Because what I have happen more often than not is people will come in and I say, when did it start? Oh, maybe 3 weeks ago. It's okay, I can work with that. What did you take for it? Oh, it was something over the counter. Okay, what was it? And then I have to go through a list of medicines that may make sense for it. And they say, oh, yeah, that sounds about right. That takes a lot of time. And so, me having to go and your doctor having to go through a whole list of things to try to figure it out, it takes away from us being able to come up with a nice treatment plan that makes sense for you. So, if you have all of that information ready for us and you can recall it very quickly and very easily, then it makes our job much easier. We're able to start putting things in and out and then coming with a much better treatment plan for you. So you must be prepared. Got it? All right. So the next one, the second part is ask questions. So you've done your part, you've come in and you are prepared. So now you are wanting to get your answers. So what you have to do is you have to ask questions. Well, this is what it is. The thing is, your doctor is going to take all that information that you gave them. They're probably going to ask you a few questions. They're going to do a physical exam. And then at the end, they're going to come up with a treatment plan. And in that treatment plan, they're going to say, we're going to do this medicine or this intervention, or I'm going to send you to a specialist. Okay. Whatever that treatment plan entails, This is your time to ask your questions. One of the reasons why this is the time to ask is because you will not be able to easily have access to your doctor most of the time after you leave the office, because you're going to have to call, you're going to talk to the front desk, they're going to put your message through the nurse, and then the nurse is going to have to ask the doctor, and then they have to get back to you. So there's a delay a lot of times in that. Not for me in my office, but for most of the offices that are out there, that is what has to happen. Even if you put something out on the portal, some people get back to you relatively quickly. Sometimes there's a delay, or they may not understand the question that you're asking. Then they say, okay, you have to come back in. So you want to use that time wisely to ask your questions. So they're going to give you, let's say, a medication. With medications, your main question will be side effects. What kind of side effects is this medicine going to have? Most common, because we can pull up any medicine and we can see a whole list, and it's going to give us all these different things that could happen. But we want to know what is the most common thing that happens with this medication, because that way you can now use that information and say, is this medicine going to make sense for my lifestyle? Is this medicine going to make sense for me? Because what I do know is that I can come up with a beautiful treatment plan for my patients all day long. But if you don't trust it or you don't understand it, you're not going to do it. And what happens is that hinders both me and you. It hinders you because you're not getting the health care that you need and your issue is not getting resolved. And it hinders me because I am trying to help you get well, and what I'm doing is not working. So what you want to do is talk to them and have a conversation and say, oh, well, you're saying that this medicine is going to have me to go to the bathroom a lot. Well, at my job, I really am not going to be able to get up that often to go use the bathroom. So I'm concerned about that. What other options do you have? Is there anything else? If it's a short term medicine, then that might be the only option. And they say, well, let's see if we can do this for the next few days. Then after that, you're done. But if it is something that's long term, then let's see if there are any options. Sometimes there are, sometimes there are not, but you at least need to have that discussion so that you can know, and then make sure that you are getting the care that is tailored to you. So you want to be able to ask questions. The other question that you need to do is clarifying questions. Because we are trained in medical terminology, a lot of times we use it and not even thinking about it. So we may throw a term out there that you're not familiar with. Don't be embarrassed to ask a question and say, what does that mean? What are you talking about? Because we say, oh, we may not even be aware that we said it. So then we can come back and give it to you in something that makes sense. So ask us, what does that mean? So that way you will know, so that way you can get what you need. So you are prepared, you have asked questions. The third thing you want to do is, if you're still having this issue, you need to follow up. You absolutely have to follow up at least one more time. Give this person another chance to make it right, to make you better and whole, and make your whole situation make sense. You have to follow up. And by follow up, you may have to go back into the office. They may not be able to do a phone call or whatever. But if you have this concern, again, know what they said. Keep track of what happened when you were on your medication. Did things get better? A little bit better? Did it get worse? Did it nothing happen? Did you have a lot of side effects on the medication? And as a side note, if you start having side effects on a medication, usually they will go away within 3 to 7 days. If there's something that's really, really concerning, like, oh my gosh, like I'm having the worst headache of my life, or I feel like I'm passing out or anything like that, then that's when you need to go ahead and stop the medication and seek medical treatment. But if it's something that is just not too bad, usually about 3 to 7 days is what we tell people, especially if you talk to your doctor and they told you you're going to expect this and you know it. Give it about that time to see if those things will resolve, if it truly doesn't super duper affect what's going on with you, because usually the medicine settles in your system and then you're fine. And then you don't usually experience that anymore. But if you start having that and then they say follow up in 3 months, and within those 7 days and after 7 days you're still having that, then that is the time where you need to go ahead and call them and do a sooner follow up, or see if they're able to give you something else before you're able to get in. So that's just a quick bonus for you right there about, asking your questions and following up. So that was your third step, follow up. The fourth thing is, you have followed up, you're still having this issue, you are trying to make it work, but it's not working. Second opinion. I am not opposed to getting second opinion. As doctors, we are all trained, right, accordingly and have done the things and passed the tests and done all of that. But a lot of times, because there's so much information, someone else may have read this one little piece and they remembered that and they said, huh, let me see if that makes sense for this person. Or they went to this conference and this conference made it make sense for them. Whatever. Go and see if you have a chance to have a second opinion with someone else so that they can help figure out what's going on with you. So you can either ask the doctor that you're with if they will refer you to someone else, or you can refer yourself, especially if it's primary care and you're just going primary care to primary care. Then you don't need a referral. If you're doing another specialist, some specialists will be honest and say, listen, I do have a partner who specializes a little bit more in this because your case is unique. And so I'll get their opinion on it or have you to see them. Or they will say, they might be willing to refer you to someone else. If not, you can go back to your primary and say, hey, I would like to see another, whatever specialist that is. If it's cardiology, pulmonology, kidney specialist, any of those. But you can always ask your primary to go ahead and help you get a second opinion. Ask around, hey, I'm having this issue. If you have any friends that say, oh, yeah, my doctor's great, then you can go and see them. But I'm not opposed to that. And then once you have done that and you've gotten your second opinion, the last thing that you need to do is step number 5 is you have to be persistent. So you have to make sure that you follow up. You have to make sure that you are asking the questions and the clarifying questions. And then you have to keep going around until you find someone who will listen to you and who will take your concerns seriously. So I've done all the steps. I am prepared. I've asked my questions. I have followed up. I even went for a second opinion and I'm still not quite getting what I need or I don't understand. Then it is time for you to go ahead and continue still with that fifth step. You have to be persistent because this is your life at the end of the day. And if you want to be well and you feel like something is not working out, then you have to do that. I've seen some people that said, this is still a concern to me and I know something is not right. Then I say, okay, well, let's find someone else who might be able to figure this out. And then lo and behold, we might find that other person that says this, or we find another person who is able to explain it better and make that person feel a lot more comfortable with that same treatment plan and say, well, these are the appropriate things and this is why and blah, blah, blah. And that person's, oh, okay, now it makes sense. But you want to be able to get connected with someone who's going to do these things for you. And like I said, find that person who can help you advocate for yourself or start advocating for yourself. And this is something that I do all the time for my patients. And I know that it is very serious and it is important to do because I am seeing a lot of patients, unfortunately, falling through our healthcare cracks, right? And what's happening is our providers, doctors, physicians, nurses, all of those who are in healthcare are stretched very thin. And not because they want to, but because that is how this system is set up. So, in order for you to be able to help them, you have to be prepared and have the information and be able to advocate for yourself because they may not be able to do it for you, unfortunately. Now, what I do is I advocate for my patients all the time. If that's calling a specialist to say, hey, can you get this patient in sooner? Or calling that specialist and say, hey, I saw that you did this and I saw that this was going to be the next step. I just want to clarify and make sure so that way when the patient comes to see me, or I have the patient sitting right here and they're still confused, and I just want to make sure that this is what the plan is. So that way we can all make it make sense. But that is what you want. You want someone on your team who can help you do that. So if you are still looking for someone to help you advocate or advocate for yourself, then feel free to look us up because we're still accepting new patients. Find someone who's going to be willing to help you do that. And we will continue to help you get the healthcare that you need and that you deserve. So until next time, I will see you soon. Bye bye.